Q. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating a fruits. B. Salt. C. Pepper. D. Ketchup. Rationale: pepper is not processed and contains bacteria. Answer A is incorrect because fruits can be eaten, they should be cooked or washed and peeled. Answers B and D are allowed. Q. A young adult is 20 years old and has been recently admitted into the hospital. According to Erickson, which of the following stages is the adult in? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame. D. Intimacy versus isolation. Rationale: intimacy versus isolation. 18-35 years old. Q. After the physician performs an amniotomy, the nurse's first action should be to assess a degree of cervical dilation. B. Fetal heart tones. C. Client's vital signs. D. Client's level of discomfort. Rationale: when the membranes rupture, there is often a transient drop in the fetal heart tones. The heart tones should return to baseline quickly. Any alteration in fetal heart tones, such as bradycardia or tachycardia, should be reported. After the fetal heart tones are assessed, the nurse should evaluate the cervical dilation, as stated in answer A, vital signs, as stated in answer C, and level of discomfort, as stated in answer D. Q. The nurse is caring for a client who is nauseated and in danger of aspiration. Which action would the nurse take first? A. Administer an ordered antiemetic medication. B. Obtain an ice bag and apply to the client's throat. C. Turn the client to one side. D. Notify the physician. Rationale: turning the client to the side will allow any vomit to drain from the mouth and decrease the risk for aspiration. Answers A, B, and D are all appropriate as nursing interventions, but a patent airway and prevention of aspiration is the priority. Q. A client hospitalized with chronic dyspepsia is diagnosed with gastric cancer. Which of the following is associated with an increased incidence of gastric cancer? A. Dairy products. B. Carbonated beverages. C. Refined sugars. D. Luncheon meats. Rationale: luncheon meats contain preservatives such as nitrites that have been linked to gastric cancer. Answers A, B, and C have not been found to increase the risk of gastric cancer, therefore, they are incorrect. Q. The nurse is providing care for a 10-month-old infant diagnosed with a Wilms tumor. Most parents report feeling a mass when A. The infant is diapered or bathed. B. The infant raises his arms. C. The infant has finished a bottle. D. The infant tries to sit. Rationale: a Wilms tumor is found by most parents when the infant is being diapered or bathed. Answers B, C, and D are not associated with a Wilms tumor, therefore, they are incorrect. Q. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating A. Fruits. B. Salt. C. Pepper. D. Ketchup. Rationale: pepper is not processed and contains bacteria. Answer A is incorrect because fruits can be eaten, they should be